If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to the 9th season of Ask the Doctor. This series was created to assist you in understanding medical issues so you can take charge of your own health. Now, there are two ways to get through. First, you can call in, and the second is by visiting our website at netny.net/askthedoctor. There's also a new feature on our website. It's the forum, where you're invited to voice your thoughts and opinions on different health topics. I use this medium to talk about issues we don't cover on the show. The forum is also where you can find out about our special Brooklyn College session, which we'll be doing tomorrow, so check it out. For this episode, I have Dr. Barbara Gatton, emergency medicine attending at New York Methodist Hospital. Then we have Dr. Ivan Grunberger, chief of the Department of Urology at New York Methodist Hospital, and Dr. Stanley Chabelle, the chief medical officer at New York Methodist Hospital and specialist in internal medicine and pulmonary medicine, also at New York Methodist Hospital. I want to thank everybody for coming, for tuning in. We have a great panel, as you can see, and you may recognize some have been on previously, and we have Dr. Gatton for the first time, so we're going to get to them in a minute. But first, there's been a busy news week, and we want to go over what's happened in the news this past week. And once again, the swine flu, or the H1N1, continues to dominate the news. And we're getting some very alarming statistics, the way it's affecting pregnant women and children. And something that's very alarming, in the last 2 months, as many children have died from the swine flu as we expect in a whole regular season of regular flu. So this is something that, while we say it's not as deadly as the regular flu, for some it is. And to avoid a vaccination, which I hear a lot around the neighborhoods, the vaccine is going to hurt my child, it's got poisons in it. This is totally erroneous thinking. It has no scientific basis. And if you really want to make sure that you can sleep well at night, that your child's going to be protected, make sure you get that swine flu vaccine as well as the regular vaccine. And remember, if they're under 10, it'll require a couple of visits. Also, pregnant women. There was an interesting story in today's New York Times about an otherwise healthy woman who had a devastating course where she was in a coma, she lost the baby, and all because of the, quote, mild swine flu. And she had mild symptoms to begin with. Again, we have a vaccine. Pregnant women, children, people who have asthma or any kind of chronic lung condition should be getting this right off the bat. So as soon as you can get it, make sure you get it. It is safe. Anything is a risk. There's a risk crossing the street, but it's basically safe. Now, another topic that came up, and a lot of parents ask about this, internet addiction. And they think, oh, you get hooked on the internet. And it is a real problem for our teens, particularly, and particularly for boys. And there are signs of addiction that you could be looking for. One is a preoccupation with the internet, where it begins to exclude other things at the expense of being on the internet. Misses family occasions, doesn't want to go out with the family. Stays online longer and longer. If you limit the child's time on the computer, he becomes depressed and irritable, maybe even hostile. His grades deteriorate. He uses the internet to deal with difficult life situations. Unfortunately, let's say there's a divorce going on and he escapes by using the internet, chat rooms or whatever games he might be playing. He lies about his use on the internet, and you'll see that a lot. I wasn't on it, I was in there studying. He stops interacting with family and children, his friends and his siblings. There's a drastic change in eating habits. You may see weight gain. They don't eat at regular times. They're eating a lot of junk food. An increase in daytime sleeping, because they're talking all night on the internet. They're communicating. And uses constant excuses to miss school. So it's something that's real. It seems to affect boys more than girls. And it seems to have a more increased incidence if you have ADHD, this hyperactive disorder, or if you have mental underlying psychiatric problems to begin with. So it's something you should be looking for. And the key is to get in early, because that's the best way to treat it. Get in early, so look for the signs, get into your doctor. There'll be more on that in the tablet this week if you want to read on it. Now, we get to this all-important quiz. Every week, for some of the guests that don't know, we have a quiz with a beautiful prize, a plaque handmade in Japan, and it says on it, winner of the Ask the Doctor quiz. So let me give it out, and watch how fast. This is a very bright audience. Which U.S. president got over a broken engagement by reading the Bible He said the Bible is the best cure for the blues, and he also said the Bible is the best gift that God has given man. So it's a president who really was impressed and valued the Bible and used him to get over a difficult situation, a broken engagement. We're going to take a short break now. Now, our phone number is 718-499-6101. And when we come back, we'll be talking about emergency medicine, urology, and lung disease. So when we come back, we'll go right to the phones, 718-499-6101. Don't let me catch you watching the Yankee game. Okay, we'll see you. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor. Our topics again are emergency medicine, urology, and lung disease. The number to call is 718-499-6101. Now we're going to get to our guest, but before we get to our guest, I see Monsignor Bennett lurking out there. Monsignor's been here for every show for the 9 seasons that we've been at. Thanks again for coming every time there. And we have people at home who watch the show, and I have to mention Vernicia. I never heard that name, Vernicia. Have you heard that? V-E-R-N-I-S-E-A, Newland. She was, when I got my flu shot, she was the one that gave me the shot, so I wanted to tell her I'd introduce her on the show so she didn't go in too hard, you know? So thank you, Vernicia, for doing that. Joan DiPrizio, who runs the gift shop, is on the board at New York Methodist, and has raised enough money for an MRI of the breast. The whole machine we're going to get, so we want to thank her, and that's coming soon. And then one other, Mrs. Fiascanero, who's the mother of many of we have 2 or 3 obstetricians who she's, two. We weren't sure about the third. And the 2, it's not hers. And but anyway, she had a little bout with the floor, and she's feeling much better now, so we hope that she's on the mend. Now, our guest, sitting next to me, Dr. Barbara Gatton, emergency medicine. I pick up an accent. It's not quite Brooklyn. Where is that?
Kentucky.
Whoa, Kentucky. I never thought that song, what is that?
Going to Kentucky, going to the fair.
Are kids singing that? They're saying go to New York or something to the fair, or what? What are they singing in Kentucky?
Well, we all wanted to come to New York.
Yeah. So tell me, I understand you have some interesting hobbies.
Well, I like to hike, and I like to ride my bicycle.
Like what kind of hiking? Like serious hiking, or you go in Prospect Park, you go to the hill, or what are you doing?
Well, for my 40th birthday, I went to Mount Rainier in Washington, and I am trying to get to the Himalaya to go partway up Everest with one of our pediatricians, Dr. Nitin Ron.
Very nice.
Oh, yes.
In emergency room, we'll talk a little bit about patients are upset. I went there, I waited 6 hours, they didn't do anything for me. You know, you hear this stuff. So I want to get into that in the discussion after a little while. Let's try and talk about that. And a little bit more about the swine flu to try and reinforce, okay? But thanks so much for coming. And your brother, was he going to be 40?
He just turned 40.
And he's a runner-up to Nathan Lane in the drama desk
And a
award?
drama desk, that's
Very
right.
good, very good. So, now Dr. Grimberger, it's been a while since you've been with us?
A few months. Yeah.
Time flies, right? But you were a great hit on the last show. And I'm always, in Daily News, he's always written up in a column on New Year's Eve, or Christmas Eve, is it? Where Pete Hamill's brother writes and says who he's thankful for. And Dr. Grimberger, he mentions.
And he always misspells my name, but I never tell him.
But how did that come about?
Well, he's a patient, and so we became friends.
But that's really nice. I always like to see. I feel proud that you're a friend, and it's a pleasure to have you with us tonight.
Thank you.
And you also have some hobbies, I think?
I like skiing, and I play soccer.
Very good. You still playing?
Yeah, not competitively anymore. But
where do you play? In the Prospect Park, or where do you play?
I pick up games in the park.
Very nice, very nice. So we look forward to seeing you there. And Dr. Shabel, who's amazing, was in Turkey just a few hours ago. And what's your jet lag? What's your time right now? 3 a.m. or something?
Exactly.
3 a.m. It's amazing. What was the most amazing thing you saw on this trip? Something that sticks out in your mind?
Probably the mosque, the Blue Mosque, and the museum. The museum was originally Orthodox Christian, and then it became Muslim, and now it's become a museum, and they're restoring and taking off some of the facade, and you're seeing the old images come forward. the crosses and the images, because, you know, the Muslim faith doesn't have images in the mosque. So it's pretty fascinating.
You know what's amazing? Dr. Chabelle is the chief medical officer, and that's a difficult job, which he does amazingly well, because you've got all factions vying for new equipment, for power, and Dr. Chabelle really treats everybody fairly, not just because he's my boss, but because, no, that chief medical is not an easy job to do. And
Dr. Grunberger wants a robot.
Yeah, okay. What's your greatest what do you think in the last year or two, something that stands out that you're really proud that you engineered, a change or a new service?
Well, we're really right at the cusp of opening the brand new, as you know, Steve, biplane imaging program, which will be of great use both for radiology, interventional radiology in general, all these advanced procedures we do for patients, and also the type of work we'll do on the brain for the treatment of strokes, which will really be fantastic.
We'll actually reverse strokes in some cases. Amazing.
Exactly.
So we've got a brief introduction to our guests. And now let's go right to the line with that all-important, who's going to be the first caller of the day? Is it going to be Maddie? Is it going to be Joel? Let's see. Hello? Who is this, please?
Hello?
Yeah, who is this, please?
This is Madeline Mara.
Hi, Maddie. How are you? You won again this week. I think you beat Joel out by a hair. Maddie's overwhelmed. Maddie, okay?
Yeah.
Okay, this is not good. Not easy on the heart. So, Maddie, what's the question today?
I'm not looking forward to getting that shot.
You're not looking forward. So let's see if Dr. Gatton can talk you into that shot.
Maddie, it's important to get the shot for a couple of reasons. One is we have no cure for the flu. And I know you've heard about some medicines that you can take if you get the flu, but all of those do is they might make the symptoms a little better, and they might shorten the course by a day or two. And that's might. So this is a disease that can be deadly. And it's not, there's no cure, but it is preventable, possibly if you get the flu shot. So it's worth it to do it.
Maddie?
Yeah.
How old are you now? Maddie, you
88.
never forget. 88. Maddie's 88.
I took a shot during the Second World War. We took a shot.
Okay, so we take it every 50 years. That's good.
This is the year to do it.
Maddie, take it and
Okay,
have a good week.
you.
Take care. Now we have Joel, the runner-up. Hi, Joel.
Oh, hi, Dr. Garner.
Joel, you just missed out on the contest.
Oh, no, I woke up so early this morning to get ready.
Hey, we got a great panel tonight. I don't know, very
Great
impressive.
panel. I actually have a question for Dr. Grunberger.
Oh, he's right here?
Okay, good. So my brother, I think he had a kidney stone a couple of weeks ago. He had some pain in his back. He went to the emergency room. I don't know, I think they gave him some fluid. But what can he do to prevent these from coming back?
Well, there are a few things that he can do to prevent these stones from coming back, because once you do have a kidney stone, if your lifestyle, your fluid intake, your activities don't change, you have close to 100% chance of having another one at some point. So there are a few very simple things that can be done that can really prevent these things from coming back, or at least decrease the chance of them coming back. Number one thing is fluids. Drinking, just being, not just when you have the pain, but just as a life habit. And I always tell patients, my kidney stone patients, they should become waterholics. Drinking, and we recommend 8 to 10 glasses a day. But the easiest thing to do is to just get used to looking at your urine. And the clearer it is, the less concentrated, and the better that is. So I always tell patients, make sure urine looks very clear. And the other thing that he can do is consume citrus products, oranges, grapefruits, lemons, or juices from those, because they're great at preventing kidney stone formation. Most people think that cranberry juice is the great thing to consume, and that's not the case. Cranberries are good in preventing urinary tract infections, but not kidney stones, because all the berries contain a lot of oxalate, which is a major component of most kidney stones.
You mentioned no alcohol in a way. You were joking about it. What if somebody likes beer? Is beer good to drink? Makes your urine look clear?
Well, yeah, but it's also, all alcohol can dehydrate a little bit. Right, so you really it tastes good, but you should chase it with some water.
Very good. Anybody, Dr. Chabelle, any thoughts on kidney stones?
I think it's important if you can capture the stone, or if it can be identified and analyzed, so you have some idea as to what type of stone it is, because depending on that, you might change the treatment.
Sure, that is one of the most painful things. When people come into the emergency department, you can see them down the hall, you know what it is.
We know right away, and it's very painful. So drinking lots of water to prevent it is, anything you can do to prevent disease rather than coming to see me in the emergency room is better.
So, Joel, I hope you
Yeah.
have a good week. Tell your brother to
you.
drink plenty of water, okay? No, stay away from the beer.
I'll let him know. Thanks a lot.
Take care. We now have Robert with us. Hi, Robert. Now, Robert, there's a rumor that you might have the answer to the quiz.
Yes. Is it John F. Kennedy?
Say it one more time.
John F. Kennedy?
No, I'm sorry. No,
Oh,
no,
okay.
no. But it's a good thought. It's a good thought. Kennedy was a religious man, and but not the right answer. Not his broken engagement.
Oh,
But,
okay, Doctor.
Can we help you with something else?
No, that's about it.
That's good. Okay, call us back and be well. Okay, now we're going to Andrew, who may have the Andrew.
Yes,
Now, again, I'm told in the studio you think you might have the answer to the quiz.
that's correct.
Okay, let's hear it. It's a president who used the Bible to get over a broken engagement. He said it was the greatest gift God gave to man, and his favorite book. Who is this president?
I believe it may be President George Bush,
Ah, George Bush. The first or the second?
the second.
No, I'm sorry. I'm sorry. Good guess. Good guess. Again, a deeply religious person. Can we help you with a medical issue tonight?
Yes. Well, every now and then I suffer from pain in both shoulders, sometimes radiating down to my fingers.
Okay. How old are you?
46.
Are you overweight?
I'm 6'1", about 235.
You in good shape?
Yeah, pretty good.
Okay. Again, he comes into the emergency room complaining of pain going down both hands.
Often this can be from something going on in your neck or your back. So it's important to see your doctor about that and see if there's some tests they need to do, maybe something as simple as an x-ray and possibly an MRI. But it is important not to ignore it and go see your doctor as soon as possible.
Dr. Chabot, some medical problems that might cause bone pain, like that pain. Anything come to anything you're
How
concerned?
old are you?
46.
Well, when you talk about, as Barbara pointed out, things that can affect your spine, then of course you have to think about things that go to bone. And I'm not trying to frighten you or anything like that, but so you have to rule out the possibility of some kind of growths or things of that sort. Although I think most commonly it would be arthritic or even a disc, although it's an uncommon location.
Luckily, with this
for a disc.
imaging that we can get and see, get to make sure, rule out a lot of the more serious things and try and figure out if it's a disc or something like that. So are you seeing a doctor for some x-rays?
Not at this moment, no.
So you can give us a call. The number's on the screen. We can help you out either with a referral or actually help you get an appointment. Okay, Robert?
Andrew.
Andrew, I'm sorry. You got me so with the quiz. You almost had it. You have my. I'm still not right. Okay. Thanks a lot.
All right, thank you.
Take care. Hi, John.
Hi, how you doing, Doctor?
Where are you calling us from?
I'm calling from Canarsie.
Canarsie. My kids went to school. I love that neighborhood out there. How are things out there tonight?
Oh, not too bad. Doing okay. Just hanging out watching you guys.
Remember Grabstein's restaurant? You weren't there for Grabstein's.
I do, yeah. Some great hot dogs.
I know. Some of the best hot dogs. You missed it, I think, right? You didn't get. Do you get a hot dog in Kentucky? And I'm not sure.
We make them in Kentucky.
Do you remember Grabstein's?
Never heard of it.
No, one of the best delicatessens.
Is that right?
Yeah, tremendous. What can we do for you?
I had a question about blood sugar. I recently went to the doctor and had a little infection in my face, and I had taken Levaquin, and they took me. I had eaten that morning, and they took the blood test, and it came out to 150.
Okay.
And,
when was the test taken in relation? You had breakfast, and then
I had probably about I guess maybe 2 hours, about 3 hours after breakfast, something like that.
Let me ask Dr. Chabot. He had a blood test 2 hours after he ate, and it's come back 150, and he's a little alarmed.
Well, I don't know exactly what you took in during that breakfast, but I think in order to, you're concerned about diabetes, so I think the important thing is that you have to have very specific timing and a very specific amount of glucose that you take in. And thinking about it today, it sounds a little different type of testing may be helpful, and it's called a hemoglobin A1C, which is basically a metabolic summary of the last 3 months of how your sugar is being metabolized. A lot of doctors aren't thinking about it these days. They're still sticking to the old glucose tolerance concept. But I think the hemoglobin A1C can give you a good insight as to whether your glucose is really, your metabolism is out of whack over a period of time. And you might want to have that test done.
Interesting.
Okay. I bought one of those meters, and the first time I took it, I was on antibiotics. I was on doxycycline, doxycycline, I guess it is called, and when I took it, it was like 114, and then the next day it was 130, and that was on fasting.
Fasting.
Well, if it's fasting at 130, you probably, at a minimum, have a tendency or some mild diabetes. But you might want to do a hemoglobin A1C. That'll give you kind of. You agree with that, Barbara?
Absolutely. It's an easy.
It's a simple test, the same thing. It's just a different
So
evaluation.
go to your doctor, ask him to get this test. Maybe related. Sometimes with diabetes, you may be more prone to certain infections of the skin, and this could be what's doing it. Again, not to worry because it could be controlled. That's the good news.
Could we ask the caller, is there diabetes in your family?
No, there's not. No.
Oh. Are you significantly overweight?
No. I mean, a little bit overweight, and I have bad anxiety. Is anxiety playing it up?
No.
No.
Well, not really.
Okay, I think that it's time to get into the doctor, get that hemoglobin test done, and let's see what's going on. The sooner we get at it, the better.
Okay, well, thank you very much.
Take care, be well. Now, Janet's with us. Hi, Janet.
Hi, how are you?
Where are you calling from?
Brooklyn, Bensonhurst.
Bensonhurst, yeah. Now, is there a possibility you may have the answer to the quiz?
I think it's Abraham Lincoln.
There's pandemonium in here. Abraham Lincoln is the correct answer.
Oh.
Do we all get prizes?
But it's interesting. How did you get that one, by the way?
I remember he was so morose after his fiancée died.
Yes.
And it was just someone I like in history.
He was great. And did you know, I never knew this, but when he said a house divided against itself will not stand, that came from quoting from Luke, which was from the Bible.
Yes.
That wasn't he didn't make that up. That came from the Bible. He also did the freeing the slaves based upon his reading of Exodus from the Old Testament. So this is
the Emancipation Proclamation.
Exactly.
Yeah.
So this is great. Any other thoughts on Abraham Lincoln?
No, I just thought he was a very gentle soul, and I had read where he had lost 4 elections before he even became president.
Yeah.
Everything he ran for, he lost. And
so what's the moral?
The moral is keep on going.
Yeah, don't give up. And for winning that, now you're going to be getting the plaque. It's going to be rushing to you by freight mail because we try and save a little bit of money, but it should get there soon.
3 days in a camel, by camel.
Yeah. But
if I see the camel, I'll know.
Is there a place on the wall that you have picked out?
Oh, please, of honor. My mother thanks you. My father thanks you.
Well,
I really feel like I've won an Oscar.
He's going to be in the bedroom or in the library?
Oh, he'll be probably the library.
Excellent. So we'll be getting that. You got to stay. Give your name to the screeners.
Right.
And really thank. Do you have a medical issue tonight, or you're so overwhelmed?
Actually, no, I don't. I can't speak.
Can't even speak. Okay. Thank you so much. Great answer.
Thank you so much.
Take care.
Bye.
We're now going to go to Terry. Hi, Terry.
Hi.
Hi, Terry. Did you know who that answer was? You know it was Abraham Lincoln, or you?
Yes, I did, but that's not why I'm calling.
Oh, all right. You missed it by 1, but next week.
I wanted to say hello to you. I don't know if you remember me, but I used to work with you at St. John's Hospital in Queens.
What's your first name?
Terry. My last name is Poganic.
I remember you. Yes.
And then
do I still owe you money?
No.
Okay. I didn't know. I'm getting these calls.
No. It's just so nice to see you on TV. And I just wanted to say hello. And also, I read your article in the tablet every week. And each time I see it, I thought of maybe dropping you a note. But now, tonight, you're on the TV. So I'm just calling to say hi.
That's very nice.
I'm glad to see you're doing well.
Thank you.
Mm-hmm.
Thanks a lot. I know that hospital is not open anymore, St. John's, Queens, which is a beautiful hospital.
Yeah.
And
well, I haven't been there in many years. I left, and I'm a nurse, as you know, and I work at a different hospital in Queens.
Well,
but I was just so sorry to see St. John's close, along with Mary Immaculate. Very tragic for the people in those areas.
You're right.
Mm-hmm.
Anyway, I hope you have a great night, and maybe we'll get a chance to talk later.
Okay. Nice to see you. The best to you.
Thanks a lot. Let's go to Rose. Hi, Rose.
Hello?
Hi, Rose.
Yes.
Hi, where are you calling from?
Sheepshead Bay.
Sheepshead Bay, wow. What's that place on the water? Funetta? Il Funetta?
Il Fornetto.
Fornetto, how is that?
It's not bad.
Yes, yeah.
It's the only restaurant on the water that has windows on the water, so it's very pretty.
How do you figure that? You would think people would be wanting to capitalize on that beautiful view.
No, the other restaurant that I go to, the Turkish restaurant, Liman, is on the water, but it doesn't have any of its windows facing the water.
Dr. Chabel just got back from Turkey, actually. There's a beautiful Turkish restaurant.
Is he Turkish?
No, he's not Turkish, but he went... What's the name of the restaurant?
My restaurant?
Yeah, there's a
But I
beautiful...
go to Liman, L-I-M-A-n.
L-I-M-A-N. I recommend... I've heard good things about it.
On Emmons Avenue in Sheepshead Bay.
So anyway, what can we do for you tonight?
Can I ask 2 questions?
Well, let's hear. What's the first one?
The first one is, I've had 2 lithotripsies, and I was told to capture my urine and strain it for any residue that they might be able to analyze. There was never anything that they could analyze. So I stopped taking calcium. I'm 75 years old, and I've had bone density tests, and they said I'm borderline something. I don't remember the term. But I'm afraid to take calcium.
Okay, let's ask Dr. Grimberg first, just briefly, lithotripsy, in case people don't know.
Lithotripsy is a non-invasive way of getting rid of kidney stones, and basically we use shock waves that are directed at the stone. The shock waves are created outside of the body. They're directed at the stone inside the body, and without having to enter the body with any instruments, we break the stone into very fine particles that then just pass in the urine. So it's totally non-invasive. In terms of the calcium, most kidney stones are made out of a combination of calcium and oxalic acid or oxalate. And in the old days, we used to tell our patients to limit their calcium intake, not to drink milk and eat cheese and so on. But what we've learned is that actually the calcium is not the culprit. It's more the oxalate, and it's the combination of the two. So that we've actually gone away from restricting calcium, and especially in women, especially in postmenopausal women, because we are worried about osteoporosis. So it's much more important to limit oxalate sources, which are high in green leafy vegetables, nuts, colas, chocolate, and berries. And that's why I said before that cranberry juice is not that good to drink.
No, they told me no cranberry juice.
Good. But I would not limit the calcium, and I would not be worried about it. If you're good about drinking plenty of water, drinking orange juice and lemonade and grapefruit juice, which prevents stones from forming, then you're in good shape. And especially if you're borderline right now, don't take your calcium.
What about disease? We're talking about kidney stones, and certain conditions predispose to kidney stones that you might have, certain underlying medical conditions. Dr. Gatton or Dr. Chabel, any thoughts?
Well, I think there are people who have uric acid stones. Some of them have gout and some don't. So people who have high uric acid levels, they put more uric acid out, and that can crystallize. There's another syndrome which is very unusual. I happen to know somebody whose wife has it. I won't divulge the name under HIPAA. But Ehlers-Danlos syndrome, and you get some of these stones which are not calcium and not uric acid, but there are other types of stones. So xanthine stone.
What did he describe? Something with the hands?
That's a different. There's a disease with laxity of the cartilage and joints and so on.
It has to do with the connective tissue. But I'm merely saying there are some rare causes of non-urate, non-calcium stones. But really, by collecting the urine and analyzing it, you may come to a clue in terms of this. But most people have calcium or urate stones. Do you agree, Ivan?
Yeah, absolutely.
So it seems like we got to get this collected, figure out what it is, and then decide how to treat you. What else? What was the second one? We're going to sneak in the second one.
My question is, I've been having a series of different tests, dental x-rays. I had a sonogram I have a thickening of the uterine wall, so I had a sonogram for that. And I'm supposed to go for a CAT scan. I have an aneurysm, an abdominal aneurysm.
Okay.
And I'm just afraid of all these, is it all radiation?
Right.
Are they safe to take?
Last week we spoke about, remember the radiation from CAT scans, and there's a hospital out in California, a very famous hospital, Cedars-Sinai Hospital, that had a problem with excess radiation being given off. So
yes.
yeah, so what we want to do is limit the x-rays to when they're really needed. Right. Now, sonogram is a good way to do a study without any x-rays, so is MRI. So if you're concerned, you can always ask the doctor, is there a way to find this out without doing any more x-rays? But once you get about 5 CAT scans in your lifetime, you begin to get slight increased risk for cancers and other problems.
I've only had one when they detected my kidney stone.
Right, so what you want to do is ask the doctor if there's a way to do it other than with x-rays. I think that's the best thing to do. If he says no, well, an aneurysm of the aorta is very serious, needs to be watched carefully. So there are certain risks, as always. You got to take a chance because the risk outweigh the benefits outweigh the risks involved. So again, it doesn't sound like you've had too much, but ask your doctor, okay?
He's in Israel on vacation. That's why I'm calling you.
Oh, thank you. Thanks a lot.
You.
Take care. Bye. Hi, Ruth.
Yes.
Hi, Ruth. You're on the phone. You're on the air?
Yes, I am.
Hi, where are you calling from, Ruth?
New York.
Hi. Speak up. Can you talk a little louder?
Yes, I had a stroke.
Oh, I see. But now it's much better. You're talking closer to the phone.
Right.
How are you feeling?
Not too good, sir.
Oh. When did you have the stroke?
In 2005. I have much tension now. My head hurts.
Oh,
I take clomidine, my pressure.
Okay.
I take lisinopril. I take hydrolyside. Also, I take insulin for my diabetes.
Okay, and what's the question?
What can I do to increase my control of my own life?
Right, so it sounds like you have a number of medical issues. I'm going to start with Dr. Chabelle, and everyone's going to give an opinion. How can she improve? She's got diabetes, high blood pressure, she had a stroke, and she wants to improve the quality of her life. She had it about 4 years ago, 3 or 4 years ago, this stroke.
4 years ago.
4 years.
You have a problem walking?
Do you have a problem walking?
I walk a little bit with a full-blown pain. I can walk to the bathroom, know when I have to go to the bathroom. Also, I have left hand, and those not work at all, no muscles.
Yeah, do you get out?
Huh?
Do you go outside?
Yeah.
Okay.
On the left side, I can't walk. Still can walk.
Right. So you know what I want, because I'm getting a lot of feedback. I want you to do me a favor. Turn off your TV and, hang up the phone, but listen to the answer on the TV, okay?
All right.
Okay, so you listen. Okay, now how are we going to help her? How are we going to help Ruth?
Well, I wasn't entirely clear. If you can move at all, the more you move, the better you are. Activity is one of the best medicines you can have. And also watching what you eat. If you are, it's hard when you're not moving as much, you tend to put on a little extra weight. But reducing the weight and moving as much as possible. If you're unsteady or afraid of falling, if you can have a family member or neighbor come over, and that way they can be with you, the more you can get out and the more you can just walk, the better you'll be.
Good. Ivan?
I couldn't agree more. I think activity is very important, and the diet, especially if you're diabetic, it's very, very important to be disciplined about the type of foods you eat, because that's going to help to control that. And we know diabetes, especially, it can really affect multiple parts of your body and your system. So you have to be disciplined, and both in terms of activity and diet, and that's going to help you live longer.
Dr. Chabelle?
Well, I think it depends. How old are you?
Oh, she was. We didn't get an age, but
okay, because I think more recently we're coming to understand that it's not so critical to control the blood sugar as we did think years ago, particularly if you're older. And I think you really have to see a good primary care physician to take control over your entire case, because it has to be all of these elements: activity, rehabilitation, the appropriate control of the diabetes, not excessive control, especially if you're a little older, are all important elements. But you need a person who can coordinate your care, a primary care physician who can come to know you, because the coordination of care is key in a complex illness.
And finally, Ruth, I would like to see you get out in some groups. You know, people who've had strokes, and you can get out there, talk, compare what's going on, because you'll find some similarities. Because socialization, getting with other people, is very important. Because it sounds like you're depressed, and I think if you follow this, it's going to help. And can you call us back next week so we can get a follow-up? Okay. So Now we got to take a break because we got to pay some bills here. We got to keep us on the air. And what we're going to do is we'll take a short break. And when we come back, the number's still going to be 718-499-6101. And we're going to talk about emergency medicine, talk about urology. We're going to talk about internal medicine and lung disease. So let's take a short break. Do whatever you got to do, and we'll see you back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor, where our topics again are emergency medicine, urology, and lung disease. And with me I have Dr. Barbara Gatton, Dr. Ivan Grunberger, and Dr. Stanley Chabelle. The number to call is 718-499-6101. Before we get to the phones, you know, I read something interesting last week, Daily News, that if you're enjoying a television show, that it's more enjoyable if there is a commercial, if there's a break in it, that it resets your level of enthusiasm so you don't have to carry it through the entire hour. So that's why I'm hoping that you guys are enjoying the show and that you reset your thermostat and you're ready to go. So let's see what we have. The first person that we're going to get to is Myra. Hi, Myra.
Hi.
Hi, where are you calling from?
I'm calling from the Brownsville section of Brooklyn, over by Brookdale Hospital.
Oh, I trained there. I did a year of medicine. I met my wife there, Brookdale.
Oh, great.
Yeah, no, I like Brookdale a lot.
Yeah.
So the only problem is not much to eat. No place there to eat, is there?
No.
No, we need, that's what we should do, is open up a little restaurant and ask the doctor.
Yeah, because I think the nearest restaurant to me would be if you went to the Galaxy on Pennsylvania or Linden Diner down Linden Boulevard.
The Linden Diner. How about that place? Have you been to that on Erskine Street, or I don't know how it's pronounced, where they have that new mall?
Oh, yes, Gateway Mall.
Do they have any food in there?
Yes, they have Red Lobster.
Okay.
And they have Boulder House, which is a steakhouse. And they have the, what is it, the Garden?
The Garden.
What is it, the, Olive Garden.
Olive Garden.
Oh, Olive Garden. Yeah, that's nice.
Right.
So you got a little variety. It's nice to.
So they have a little something there.
I'm good. So how are you feeling tonight?
Well, I feel pretty good, but I'm a diabetic. I'm 58 years old. I finally found out what I think it's the AC1. Mine is 9.3.
Whoa.
I'm not a good diabetic. And I was on I wanted to speak about my medicine. I was on Glucophage 1000, and I take it twice a day. But my doctor took me off that medication because he said that it wasn't working for me. But actually, it was me who wasn't working with it, because even though I take my medication every day, I'm still not eating right. So now I'm on, I haven't taken it yet, but I'm on glypyride, metformin. It's a generic of Glucovant.
Mm-hmm.
So I wanted to know, what did the doctors think about this medication?
Just before we start,
I have not tried it.
We're going to get right to Dr. Chabelle and say, just so we can get a picture. How tall are you?
Okay, I'm 5'5", and I'm 252 pounds.
Wow. Okay, so we got to work on. We got a lot of work to do here.
Let's start with. I lost weight with the Glucophage.
Mm-hmm.
I was 310.
Wow.
Yeah.
Well, let's attack this problem. We got excellent doctors here. Dr. Chabelle, we got a problem here.
Well, I think the key to the management of diabetes, you have what we call type 2 diabetes. So, I mean, you're not insulin dependent. Okay. And I think the control of weight and diet is probably the most critical factor, combined with a certain amount of exercise. Are you capable? Are you able to walk and do things?
Yes, because I'm still working, yes.
Right. So I think to get into some kind of regular exercise program, you don't have to go to a gymnasium, but to plan a program. And the best way to plan a program is to do it by time. Okay. And you say, okay, I'm going to walk 15 or 20 minutes and then turn around and come back. And the next day, try to go a little bit further. And the next day, try to go a little bit further. Before you know it, you will begin to see a significant benefit, because exercise has to do with changing the way your body manages your insulin. And I think that's a very important factor. If you get your weight down a bit, you'll require less medication and you'll do better. 9.4 for hemoglobin A1C is high.
Yeah.
We really don't aim to get it below 7. There's some people who think you should, but actually there's no great benefit, particularly at your current age. So
Right.
if you can get it down below 8, heading for 7, 7.5, that would be fine. I think adding exercise and continuing to be careful with your diet will be just as important as the medications.
Thank you, Dr. Gannon. I think.
Okay.
What do you think about this weight situation here?
I think it's great that you already lost weight. That's so important. And Dr. Chabelle is right on that exercise will help you more than you realize. And strategies like finding a friend and doing it during your break at work or after dinner. And to know if you're doing enough, it doesn't have to be long. You want to still be able to talk to whoever you're with or to yourself. But so if you're panting and then you're going too hard and you won't stay with it. But you don't want to be able to sing. So if you can sing Twinkle, Twinkle, Little Star, then you need to push yourself a little harder. Okay?
All right.
But I think one of the things we want to do is this weight we'd like to see coming down soon. So can you give us a follow-up maybe next week?
All right, then.
We'll have our own little Biggest Loser type competition here, okay?
All
So
right,
we'll hear from you next week.
All right, then.
Okay, take care. We got to go to Clara now. Hi, Clara.
Hi, doctor.
Hi. Do me a favor, talk a little bit closer to the phone.
Yes, doctor.
Much better.
Yeah.
Where are you calling us from?
I'm calling from Brooklyn,
Which part?
Utica.
Utica Avenue?
Yeah.
Yeah, again, not too many great restaurants there, are there?
No.
No, I'm telling you that there's some underserved areas for good restaurants, though. What's your favorite type when you go out to a good restaurant? What do you like to order?
I don't eat in restaurants, doctor.
I missed.
She doesn't eat in restaurants.
Oh, when you're at home and you want to prepare that romantic dinner, what do you make?
I like rice and fish.
Oh, rice and fish. That's good. It's good. Good for you. Excellent. Good. And what can we do for you tonight?
Okay. 2 months, 3 months ago, 6 months ago, I went to see a doctor and he said that I have kidney stones.
Okay.
Gallstone, in fact. And then,
too.
and then I have high blood pressure. So I want to know what should I do because they gave me some medication.
Okay, Dr. Grunberg, kidney stones, gallstones. She got high blood pressure. What does she do?
Well, I mean, the gallstones, kidney stones are really completely different situations and have different causes. In terms of the kidney stones, which what I deal with, it's important to see exactly if you I assume you had some sort of X-rays or sonogram that diagnosed it. It's important to see exactly the size of the stones and the location of the stones because, again, I'll go back to drinking plenty of fluid because that's the key. Not all kidney stones have to be treated. If they're really tiny, then if you're good about drinking good amounts of fluid, then you can prevent them from getting bigger and from causing a problem.
Really? So she might be able to prevent this.
Yeah.
Right.
Or even past them if they're small enough.
Have you had an episode where you had a lot of pain?
Yeah, because I went to the hospital and had a lot of pain. My stomach was hitting me and I didn't know, I went to the hospital like 2 times in a week and then that's why the diagnosis.
Listen, we need you to turn the TV off because we get a lot of feedback. Okay, so I think we have a plan of attack here that we're going to, again, the right lifestyle. Any other comments before we move on? No? Thank you so much for the call. We hope you feel better. John?
Hi, Dr. Garner.
Hi, John. Where you calling us from?
Kensington, and right off Ocean Parkway in Brooklyn.
Oh, not far. There's some nice restaurants around Kensington.
Oh, yeah. Even out by 18th Avenue, not far by 18th Avenue. There's a very good Chinese restaurant, Silver Star.
Oh, Silver Star. Anybody familiar with that? No. It's something. It's a good one to. Somebody was telling me about a place called Gino's today on 5th Avenue.
Where?
Gino's on 5th Avenue in the 70s. Italian restaurant.
In the 70s, Gino's. Yeah, that's a good Italian restaurant too. Yeah.
It's supposed to be good. Yeah. What can we do for you tonight, John?
Well, I put on your show. I always watch it, but I was taking my medicine and stuff, and I had put it on late. My wife reminded me, and you were talking about CAT scans, and if you have 5 of them in your lifetime, then after that you start running into a risk of cancers and stuff. Now, I have a rare cancer already, pseudomyxoma peritonea, which is
Okay.
a cancer of the appendix.
And
I've had it now since '06.
Okay.
I had surgery, and
had it spread?
No, they got it before. There was nodules in my lungs. They weren't sure. I did a colonoscopy and stuff. It stopped short of going towards the large intestines. So they got it out. It wrapped around. I lucked out, I think, to a point because it wrapped around the appendix. So they took out the tumor with the appendix and everything. So right now I'm on a stable mode. But I've had the first year, I had like 4 CAT scans that year. They would give it to me every 3 months. Then the second year, they were giving it to me like every 4 to 5 months. Then the next year, every 6 months. Now he's kind of bad. You know, he's saying, well, we'll take a look at it and we'll possibly do it every year. Now I was never told anything about this. I just kept going for these CAT scans.
You know what, though,
not
in your
realizing
case,
about the radiation.
You
now I feel, now that you mentioned that, the last year, my body, I have very problems now with my back, my legs, my hips. Like, it's very hard. I walk with a cane now.
Yeah. So, John, let me just go. First of all, you haven't had too many because you've had appropriate X-rays to examine your condition, and you're going to need to get follow-up to make sure it's not spreading.
Yeah, that's what they had told me.
We're talking about a kid goes to the emergency room with stomach pain, and Dr. Gam wouldn't do this. But let's get a CAT scan. Let's get a CAT scan. That's the kind. So when we're talking about increased risk, we're talking of thousands and thousands of people, not in a one-person situation. So what the main message to take home is that be afraid of radiation, but know that it has useful purposes, that there are certain cases where you need to have it.
Right.
But let's talk about this. I'm really glad they got it early because this thing can spread all over the body.
God.
Any comments on his condition?
No, it gets, it's just...
We're very
lucky to
happy
catch
that
it
You're
early.
still with us.
Yeah, you're going to do
'cause
very well.
My first oncologist that I went to, right after the surgery, he had told me, because he looked at everything after the surgery and everything, because the tumor was like over 7.5, 8 centimeters, and then plus the appendix and everything. He thought I had about 6 months to go.
Yeah, this
so here I am
seed,
3 years later.
Yeah, this can seed the body, all the intestines, the mesentery.
Yeah.
You can end up with a terrible condition and you seem to have beaten it. Now we're talking about 2006.
Yes,
so very happy.
Thank you, doctor.
Be well and continue to watch 8 p.m.
Yes, I will.
Take care.
Let's
go to Joe now. Hi, Joe.
Yes, hello, Dr. Gardner.
Joe, where are you calling from?
I'm calling from Flushing, New York.
Oh, there we have some nice restaurants in Flushing, right?
Yeah, I don't need a lot of big restaurants, but there is an excellent pizza restaurant called Amore.
Oh, Amore. Where's that near?
That's in the Linden Shopping Center near Whitestone.
Very nice. Amore. We have to try that out. Yeah. I go to the Parkside.
That's excellent.
You like the Parkside?
Love it.
Have you been to the Parkside, Joe?
Actually, I haven't. I don't get to too many restaurants.
You got to go there because they got a bocce court outside that you can play. Have you played bocce?
No, I don't. I don't.
But it's a great sport. I don't know if it's a sport, but it's not. I wouldn't say it's a sport, but it's interesting. Bocce is interesting. What can we do for you?
I wanted to ask the doctor. I have COPD emphysema for 5 years. Since I'm 48, I'm 53 now.
Okay.
And it really makes me uncomfortable. I use the inhaler every 4 hours, and I use Advair Discus overnight just so that I can keep the airways open so I can breathe. But
let's ask our pulmonary specialist about that.
Okay, when I wake up in the morning is one of the bigger problems.
Okay, so the problem with COPD, some asthma.
So were you a smoker?
Yeah, I've been a smoker for over 30 years.
You still smoke?
Doctor, I have not been able to stop.
I understand. Well, I'm not trying to criticize. I'm just going to say that one of the things that if you could reduce it or stop it, it would be helpful because it won't undo whatever injuries have occurred to your lung over the years, but smoke is an irritant, and every time you smoke, you continue to produce inflammation in the airway. Now, at our hospital, we haven't mentioned our hospital up till now, which is New York Methodist Hospital, we have a division, a pulmonary division, and we have some special features in there. We have a person who has some advanced techniques in the approach to emphysema. Emphysema is not just one illness. Sometimes people have large air cysts, and they can be treated. There are some new techniques, experimental techniques. Dr. Arthur Sung is very skilled at this.
He's been on the show. Yes,
he
he's been
has.
with it.
And so I think if you have had a full workup, and I don't know just how many tests and what the findings have been, that's great. If you think you might benefit from having some real experts take a look at you, then if you call Dr. Garner, we'll be happy to direct you and make sure that you get a full evaluation. But if there's any way we can move you away from smoking, that would be great for you.
Thanks a lot for the call, and we look forward to hearing from you. Give me a call if you need help, okay?
Thank you very much.
Take care. Hi, Brenda. How are you tonight?
Okay.
Where are you calling from?
I'm fine. I'm calling from Brooklyn, Flatlands, Brooklyn.
Flatlands? Brenda, turn down the TV, please. Okay. So you're calling from Flatlands?
Yes.
There's a nice Italian restaurant there off of Avenue P and Flatbush Avenue, I think.
No. I don't really go to the pizza restaurants too often.
Where do you like to go? What's number one in your book?
I don't really eat out a lot.
You like to cook?
Yeah, most of the time I cook.
All right. That's good. What can we do for you?
Well, I was actually calling in about my diabetes. I was recently diagnosed with diabetes, and I'm really still trying to understand it. But I was listening to a lady that called in earlier, and she was saying some numbers about her diabetes, like 7s and 9s, and I don't know what that means, and my doctor's never said that to me.
Let's get a quick study on this because we only have a few minutes left. What are these numbers? Hemoglobin A1C, fasting blood sugar. Let's go over some numbers.
So, excuse me, the hemoglobin A1C is a simple blood test that gives you a sense of how your diabetes is doing over a period of months. And so it's very helpful to get this test because you can modify your diet and your exercise and your medications based on that, and it'll give you, better than any one number of how your glucose is doing on this day or that day, it gives you a bigger picture sense. And so it's a very important test to have. And as Dr. Chabelle said earlier, 7 is kind of the target that you're trying to go for.
Do you know what your number is?
No, I don't.
You got to know. So that's something you got to ask your doctor, and you got to demand that you know what that number is so you know if you're getting better. And again, we always encourage second and third opinions. You can call any one of us. We have numbers up there, and we'll help you get into the right place. Okay? And then a fasting blood sugar, which is not so much the followed as closely, but we like to see it between, 80 and 100. That would be nice. Do you know what your fasting blood sugar is?
No.
So this is something...
That's why I don't understand. Like, he didn't actually test me. He just told me that I had diabetes, but I never had an official test to know.
I want you to do me a favor. You have a number for me. You give me a call tomorrow. We're going to get you into the right place.
Okay.
Okay?
I call the same number?
The number that's up on the screen.
49. Okay.
Okay. Take
I
care.
will do that. Thank you.
Bye. And now we're going to go to Tanya, who's been waiting patiently. Hi, Tanya. Your TV off?
Hi, how you doing?
Good, good. Where are you calling us from?
Prospect Heights, Brooklyn.
Prospect Heights, nice area. Dr.
Yes.
Chabelle, were you from that area at all?
No, it's from Brownsville.
Oh, Dr. Chabelle, you should have said hello to the other Brownsville patient.
Different. That was in real Brownsville.
Yes, hello?
That was East New York, Brownsville.
Yeah. So what can we do for you?
Well, my main issue that I really wanted to ask is I had high blood pressure for about 15 years when I had my son, and I've been taking medication for that long. Now I was diagnosed with sugar about 3 months now, and I also have asthma. So these are a lot of medical conditions that I have, and I'm trying to figure out what is the best thing for me to do to maintain my health and stay strong at the same time. What should I eat? Because sometimes I don't know what to eat. I don't know how to eat. And since they tell me I have sugar, I've been just, losing weight, gaining weight. So I don't know how to understand it.
So listen, we'll do a quick answer now, and we'll come back to it next week. Dr. Chabelle, quick answer.
I think we've talked before about losing weight, and we've talked before about exercise, but probably the cornerstone to the management of diabetes is to see a person who is knowledgeable and to see a nutritionist. You need a person who can counsel you on appropriate diet and to help you understand what type of food groups and what amounts you should eat. And if you do that, your diabetes will be under much better control.
But this is disheartening that the patients don't seem to be given this information. I can't believe it. They don't, the numbers, even if they're told once, it's not told enough. You need to go back. Dr. Gatton?
One way to find a nutritionist is the American Dietetic Association. They have a website, they have a hotline. You can call your doctor for a referral or Dr. Gardner, but it's really someone who's had a lot of training in nutrition and especially
Thanks
in how
a lot. We have to run, okay? But have a nice week. And our last caller of the night waiting patiently is Kathy. Hi, Kathy.
Hi, I'm calling from Midwood, Brooklyn. 5 years ago, I was diagnosed with stage 3 fallopian tube cancer, and we had genetic testing. I'm BRCA1 positive, and I was diagnosed in January with stage 1 breast cancer. I'm in total remission for both of these diseases. However, talking to my primary care physician, she suggested a bone scan, although this was never brought up by my breast surgeon. What do you suggest?
Number one, the bone scan, there's PET scans, there's bone scans, but if your doctor felt that it was a stage 1 disease, he may not have felt that it was necessary.
Right.
Did anybody talk to you about mastectomies, preventive to prophylactic?
Yeah, that was suggested before I was even diagnosed, that I have a total mastectomy and reconstruction, but I didn't opt for that.
But many doctors may not want, I mean, some doctors want a PET scan, some want a bone scan, but if you're going to a good place and the doctor gets us, where are you going, Sloan Kettering or to locally? Where are you going?
Sloan Kettering.
Sloan Kettering.
Yeah.
So, I mean, you're going to a good place. Many of these doctors don't follow a cookbook method, but they look at you, they know, they get an idea of how sick you are. And sometimes bone scan can bring up more problems. There's a lot of things that you can't quite figure out on a bone scan. So I'd stick with him. Any other comments before?
No, I did go for radiation. We went for the 15-day radiation, which is a new Canadian study, as opposed to the 6-week radiation. And I did opt for chemotherapy only, and it wasn't part of the protocol, but only because it reduces the risk factor reoccurrence by another 12%.
Which chemotherapy? The CMF?
Yes.
Yeah, excellent. Because the studies have shown now even patients without obvious spread do better with the chemotherapy. So it sounds like you have a happy ending. We got to move on quickly. Call us back next week.
Thank you. Good night.
Take care. Good story. And I can't believe it. That's it for this episode of Ask the Doctor. I'd like to thank Dr. Barbara Gatton, Dr. Ivan Grimberger, and Dr. Stanley Chabelle for coming in. And we hope we were able to help you. It's a good idea to remember that you must be proactive about your own health. Speak to your doctors about your concerns. Go for second or third opinions, like we said tonight. In the meantime, continue to watch every Tuesday night at 8 p.m. or visit our website at netny.net/askthedoctor. There you can watch my video blog, see past episodes, or join in our forum. I want to thank you all for your calls tonight. I'll see you again next week with a brand new episode where we're going to be talking about radiology, laparoscopic surgery, and lung disease. And a special interview next week with Dr. Chris Comfort from Calvary Hospital. So for now, I'm Dr. Steve Garner saying goodbye and stay healthy, and I'll see you in the tablet.